Hello, everybody. I am Brittany Wilson. I'm really excited to talk about this topic. I'm going to be presenting WWJE, right? From way back, I don't know, in the 90s, if anyone remembers, what would Jesus do, right? WWJD. So what would Jesus eat? And I'm going to be talking to you today about Christ-centered intuitive eating and how it can benefit our patients. I am the CEO and owner of Revelation Nutrition, a registered dietitian, nutritionist, a certified intuitive eating counselor, and a certified Revelation Wellness Fitness instructor. So I look at health and nutrition from that holistic perspective. So just a little bit of background about who I am and how God transformed my relationship with food and body. I think this is really important to share with you because it is pivotal to why I started my business, why I do what I do, and the way that I understand nutrition. My nutrition journey started in high school. I always have had an interest in nutrition, but I decided to go to college to become a dietitian at James Madison University. And the reality was this was the catalyst for me developing my disordered eating. And it wasn't necessarily because of the program that I was in itself, but it was just that my underlying relationship with food was unhealthy. And I do believe that there were some things in our curriculum as dietitians that don't really look at health in the proper perspective, okay? So that being said, my disordered eating developed, and we'll talk more about what it looked like and what that is and what some signs are of disordered eating. But my passion was to work with malnutrition. So I did my internship at Iowa State University and through the University of Ghana, where I did my overseas internship, and I worked with malnutrition. Then I started as a clinical dietitian and I opened my own private practice. And I took a more traditional approach, medical nutrition therapy. I helped patients with weight loss. And it wasn't until in 2019, God began to really change my heart and open my eyes to see that my relationship with food was not healthy. And he began to transform that. And I began to notice how my clients were not really ultimately benefiting from the services that they were getting from me. So they were, yes, losing weight. They were, eating less food, but ultimately they still came into my clinic really frustrated and unhappy with their body, not feeling the best. And I was like, okay, what is going on here? And as I began to see my relationship with food as being disordered, and God began to show me the deeper heart relationship I had with my body, he began to show me how that was therefore projecting towards how I treated my patients, like providing care for them. And now he transformed the way that I approach nutrition using a non-diet Christ-centered approach in my business and with my clients. And I also continue to do work with malnutrition through a nonprofit that I work with called El Cuenco, where we do different work overseas, whether that be, in South America. I've done work continue to partner with work in Ghana. And God has really merged those two passions of mine because ultimately, as you will see, they are very similar and they go hand in hand. So let's delve into this. My intentions today are to help expand the understanding of what diet culture is, what disordered eating is, and what is an active eating disorder. What is the difference? How do we differentiate between the difference? I also would want to help us to see how diet culture is harming our patients and identify how current healthcare models increase the risk for disordered eating and eating disorders. It's also really important to understand how faith and food are correlated together. And I want to help show you how you can begin implementing methods of healthcare from a non-diet and non-weight-centric approach. Okay, so this is something that might look familiar to you. I know as a dietitian, this is something that I was conditioned to, and I hear from a lot of other medical providers these very similar statements. So does this sound familiar? Have you heard before that BMI and or weight is a direct indicator of negative health? Maybe you've heard that immediately advising weight loss before considering other health and lifestyle factors is the best way to approach a person's situation. But you might be missing that whole picture of health. And that might mean through dieting, like restrictions, exercise, surgeries, medications, right? So these are those lifestyle factors that might be recommended to patients. So if all of this sounds, if any of this sounds familiar to you, what about it? What are we addressing with this? So first, let's dive into disordered eating. What is it? What are eating disorders and diet culture? So the first definition I'm going to give you is diet culture. And this definition is a really good one that I found from an eating disorder organization in Australia. I really like the way they sum this up. But it says diet culture refers to a set of ever-changing myths about food and bodies, promoting the idea that one's body weight automatically equals health and that foods can simplistically be categorized as good and bad. It also comprises a moral hierarchy of body that preferences the thin ideal while masking a fear of fat. So this really sums it up well. And I do want to just make a little bit of a, I don't know if disclaimer is the right word, but just know that I'm going to be talking a lot about weight loss today and weight, but this doesn't necessarily mean that everybody who struggles with this is necessarily trying to lose weight, okay? We'll talk more about that, but diet culture ultimately is more of the belief and the mindset around ideal body type, as well as what is good and bad food. And this is driven by several different things. Cultural ideals. So what does our culture believe is a good body? What is considered good food? And we can see globally that this can differ. And even within different historical periods, different body types were considered more or less acceptable. So really, it's a cultural ideal being projected onto society. Also, body objectification. This is where it's the body that makes you desirable. So we also see this with the sexualization of our body, which is a form of body objectification. So it's ultimately using the body in ways that God did not intend it. And we're told we can shift and change our bodies to make it more desirable. Also, capitalist industries gain profit from body dissatisfaction. If a company is going to make money, they're going to promote it. And I mean, we all have to make money in our businesses. I get that. But this is talking about the multi-billion-dollar industry, okay? Confusion about food and eating, weight-centric healthcare, where we focus about weight loss, church teaching. So diet culture is actually found in the church, and diet culture is not biblical. And also quick fixes to deeper heart matters. So this is where we might have deeper reasons of why we're using food the way we are, why we're trying to change our body. But diets in general, diet culture, it's something that ultimately is a quick fix. So people want it. It sells easy and it sells quickly. And it doesn't lead to lasting results though. So what is disordered eating then? Disordered eating from the Academy of Nutrition and Dietetics defines it as a range of irregular eating behaviors that may or may not warrant a diagnosis of a specific eating disorder. So just because you have a disordered eating does not mean that you have an eating disorder, but everybody who has an eating disorder has disordered eating. And here are some patterns of disordered eating that you might recognize in patients, or, for me, I experienced some of these myself when I struggled with the obsession of healthy eating. So you might see dieting or any restriction of a particular food due to fear and anxiety of specific foods, dieting for the purpose of weight loss, weight cycling where your weight goes up and down, restricting particular meals and fasting for weight and fat loss, skipping meals or cutting out certain foods to make up for what was eaten before or in order to save for later, food being used for emotional processing, obsession about exercise where you can't take days off, feeling out of control when you're around food, tying your morality to the food choices that you make, like I'm good or I'm bad or I feel shame or guilt, or I'm more holy or less holy because of what I ate, excessive thoughts about food and body image, rigid food rules or schedules. So change it, that maybe you notice that you change social situations, or maybe a patient changes their social situation to accommodate for food choices or vice versa. Overeating and restricting patterns, exercising as a form of punishment or to burn off the calories that you just ate, and also hiding food and eating in secret. Now, these are just some of the patterns of disordered eating. So just know that this is not all of them. And then more specifically, an eating disorder is a behavioral condition characterized by abnormal eating behaviors and harmful thoughts and emotions, and it affects the physical, psychological, and social function. I will say disordered eating also affects these, but this is in a more severe critical state, often leading to the active need for inpatient treatment, depending on the type of eating disorder and the severity. So the different types of eating disorders that we are going to talk about, or I'm going to bring to your awareness today, are anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder. Now, bulimia is oftentimes associated with binge eating. Binge eating is excessive eating, and then bulimia is used after the binging happens. There's a purging cycle that happens, whether it be with medication, insulin, or which is a type of medication, but sometimes people use different types of can't think of the words, like enemas, and also self-induced vomiting, okay? And then anorexia nervosa is extreme restriction of food and calories. So there are definitely different types of eating disorders, and oftentimes, again, this starts out with disordered eating and it becomes more severe. And here are just some statistics that I have to present. 9% of the US population will have had an eating disorder in their lifetime. That's a large percentage of just the US population. We're not talking about the other countries at this point. But fewer than 6% of people with eating disorders are medically diagnosed as underweight. People in larger bodies are at the highest risk of developing an eating disorder. And the higher the BMI, the higher the risk. And this often comes from the weight bias that happens in our medical field. In 2020, there were approximately 10,200 deaths attributed to eating disorders. And in a study of 14 to 15-year-olds, dieting was a strong predictor of developing an eating disorder. So just to remind you, dieting is a form of disordered eating. Those who diet are 5 times more likely to develop an eating disorder if they diet moderately, and they're 18 times more likely to develop an eating disorder if you are practicing extreme restriction than those who do not diet. And 79% of weight loss program participants report coping with weight stigma by actually eating more food. So in reality, weight loss programs and dieting, disordered eating, it's counterproductive to the weight loss in the big picture of things. So how is dieting a form of starvation, and what's it doing to the body? I want to show us a study done. This study was done back during World War II, and I know it's definitely research done a long time ago, but this was a foundational study to help us to better characterize both the physical and the mental effects of starvation on healthy individuals. And these men that participated were assessed at both a normal fed state during semi-starvation, and then lastly, they were assessed during a period of refeeding. And the reason for this study done in World War II was to attempt to better support soldiers that were facing starvation during the World War II. This study took place in Minnesota with the University of Minnesota, and it was a pretty intense study. In the 3 different phases of this study, for 3 months, those men that were at a healthy, normal state were receiving approximately 3,200 calories a day. And they assessed, okay, they were functioning well, they had great muscle mass, they were feeling great. Then they began to induce them into a semi-starvation period that lasted for 6 months. And they were given 1,800 calories per day, plus they were asked to exercise. And the exercise amount was dependent upon the calorie amount that they received was dependent upon the exercise that they did, etc. And the expected weight loss of the participants was approximately 2.5 pounds a week to reach their desired 25% weight reduction by the end of that 6-month period. Then, after the 6-month period, they went through a 3-month nutritional rehabilitation period where they attempted to restore the patients or the participants back to that baseline where they were at when they first came into the study. And these were the results that they found, which were interestingly enough, as you will see, very similar to those who diet. So during the semi-starvation period, they found that participants had increased irritability and impatience. They had an increase in introversion, a decrease in energy and fatigue, or had more fatigue. a decreased cold tolerance. They found themselves to be more dizzy. They had reduced coordination, ringing in the ears. They had muscle soreness, hair loss, loss of motivation and concentration. They were found to be sneaking food, and some participants actually had to leave the study because of the sneaking of food behind the scientist's back. They also would increase their physical activity in order to get more food rations. So they become obsessed with just getting more food and eating food. And then obsession with food. So these were men who enjoyed food before, but they weren't necessarily obsessing about it. They would eat their meals. But then during the semi-starvation period, they found that the participants were doing things like collecting cookbooks and constantly noticing food everywhere they went and what people were eating and how much they ate, and they could not get food off of their mind. They also had mental distress. And so 2 participants were required admittance to a psych ward and after they were discharged from the program. So then, as they went into that recovery period, they found that the participants had an insatiable hunger, and they would often eat past the comfortable fullness. So they really struggled to feel accurate signals of hunger and fullness in the body. And that was something that took a long time for them to somewhat normalize again. They also ended up gaining weight more than what they came in with over time as they were in this recovery period, but it was particularly fat stores. And they found that it was very difficult to restore the muscle mass that they had before participating in the study. So they had more fat stores and less muscle. And then participants were required to take in an excessive amount of calories, approximately 4,000, which was more than what they came in with, in order for their body to actually utilize the nutrients and to be able to rehabilitate close to that baseline. So now let's look at how dieting harms the body when we are dieting for weight loss and even just obsession and healthy eating. Okay, so we're going to see the comparison here. The physical effects of dieting on our patients is it decreases their muscle mass, which is what we saw in the other study. It increases muscle pain and weakness, decreases metabolism. It can cause hormone dysregulation. It can lead to more weight gain over time. It can also lead to weight cycling. So this is when you might notice that the patient loses weight from the diet, and then once they stop the diet, they gain weight back or even more than what they put on or what they lost and where they were at a baseline. And then over time, as they continue to diet, the weight loss part becomes harder and harder. It also increases their abdominal fat stores, where the fat stores on the body, which that increases cardiovascular risk. It can lead to decrease in energy, an increase in overeating cycles, and then oftentimes negative GI symptoms. So I've had a lot of patients that have what they think are food sensitivities and allergies, but it's actually just the stress from the diet that they're on. And once they heal the relationship with food and they stop dieting, they end up resolving these GI symptoms that they're having. Also, hair loss is really common, particularly when you're restricting particular nutrients. And then loss of concentration and brain function. And that's even true just for those who don't have breakfast in the morning. Their mental capacity is not as high as it would be as if their bodies were in a fed state. So diet culture, the physical effects, the reality is diets are not sustainable solutions. 95% of all dieters will regain their lost weight in 1 to 5 years. Now, diet culture also harms our patients mentally. And it does this by increasing food and body obsession. It causes addictive behavior towards food, increases body comparison and dissatisfaction, increases depression and risk of suicide, and it also leads to more feelings of guilt and shame. It increases stress, which is interesting because oftentimes you might find that a lot of your patients are already really stressed with things from their day-to-day life, but this makes that even worse. It increases isolation because of not attending social events and avoiding social events, or even just the sense of not being present in the moment because a person is so obsessed and thinking constantly about what they should or should not be eating, or, you know, what are people thinking of my body? So it really causes that isolation, which can affect other aspects of mental health as well. And it can increase your negative moods, which affect relationships. And again, it decreases that ability to be present in the moment, which is that form of isolation. So here are some statistics about the mental effects of dieting. And just as well, I have lots of studies behind that show all these different effects that dieting has on the body. So if you're interested in that, I have studies that you can go through. But mentally, 1 in 4 people with an eating disorder have symptoms of post-traumatic stress disorder. So mental health goes hand in hand oftentimes with those who are dieting and using food as a form of control in order to change their body. The Dove Global Beauty and Confidence Report found that almost 8 in 10 girls, which is 79%, even more women, 85%, do not participate in important events in their life when they don't feel they look their best. And I've seen this a lot in my own clients as well. It's really common, particularly for women and men too, but particularly for women, to just not go to something if they don't feel good in their body. 7 in 10 girls say that they are more likely to be less assertive in their decision when they feel insecure. And my personal concern with that statistic is, as women, are we putting ourselves in positions to find our value and self-worth in things of this world rather than in who God says we are? And this could be putting ourselves in dangerous positions physically as well. So I think it's important to keep that in mind. Like if I'm insecure, I'm less likely to protect myself, really, because in the sense of wanting to be accepted, wanting to be loved, right? Where am I looking for that from? And spiritually, diet culture is in the church, and I've seen this with all my clients. It affects one way or another their spiritual walk, and this is why it's so important we get to the root of the relationship with food. So oftentimes we tie morality and holiness to our food choices. So we think, okay, I am more holy or less holy because of what I did or did not eat. Pride can be tied to this. Pride about, okay, I think my body should look like this, and thinking that we know better than God of how our body should look and what it should be. Idolatry of body and food, fear of lots of things, rejection, fear of not being loved, fear of chronic disease. There can be lots of fear driving the decision to partake in diet culture, and diet culture just perpetuates the cycle. So it really is a cycle that continues to happen. Also, lack of identity. So if we struggle to believe who we are in Christ, we might try to find that identity in things of the world, which might be our body. Distancing from God through shame and hiding, objectifying our body, and misunderstanding of the body's role to the entire being of the person. So what does it mean to be a temple of the Holy Spirit? What does it mean to be a daughter or son of Christ? And are we misunderstanding in the church the role of our physical body? And this is a really important question to ask. How is healthcare contributing to disordered eating and eating disorders? This one's a hard one because for me personally in my journey, I had to address this because I had to do this in my own personal life where I saw my dysfunctional relationship with food. But then I had to come to terms with, how am I causing my patients harm? And I had to shift and change the way that I approach health with my patients after assessing this. So healthcare can contribute to our disordered eating through several ways. First being weight bias. Weight bias altering our standard of care and practice. Maybe we offer certain tests or don't offer certain tests because we assume because of a person's weight that we should or should not do something in a medical procedure or a standard where we run a certain test to look for a certain disease, okay? Surprisingly enough, this happens more often than not. I've had many patients and clients and other people that I know who have the weight has prevented them from getting the care that they should have gotten. And I will show an example of this in a moment. But using weight as a vital sign when unnecessary for the visit, the medical diagnosis, and the intervention. And I do want to say here, I'm not saying that there isn't a time and place for weight in the medical field. There is, but we don't need to focus on it to the point that we are causing our patients more stress and causing a disordered relationship with food. This might be where maybe we don't necessarily weigh every visit if we don't need to. if a person, I mean, there are always medical exceptions, right? Like I understand there's edema, there's other types of disease where we need to know the weight to see changes. So I'm not dismissing the use of weight, okay? But what I'm saying is it can't be, I don't believe it's medically appropriate and necessary to use it in a pretty much like an abuse, not, that's a hard word to say, not abuse if it's not the right word, but we don't need to necessarily use this word or to use weight every single time we have a patient come in, okay? And maybe the patient doesn't need to know the weight. They have a right to know if they want, but we don't need to stress this to them. Also, assuming disease is caused by weight, shaming and shooting the patients about their food choices, encouraging the restriction of food and calories. This can cause more harm, especially if a person already has an undiagnosed eating disorder that we might not know about when they come in to visit. Especially again, that statistic earlier, it's if they're in a larger body, maybe we're assuming they don't have one, and we just go ahead and start talking about how they should be losing weight, not even realizing we could be contributing to their eating disorder. Also, using BMI as an indicator of health is an accurate use of the BMI. And then assuming someone does not have an eating disorder or disordered eating because of their weight. Again, misdiagnosis. So this is a client that I have, and this is a real experience that she had going into a doctor's office. She said, I went to a new primary care physician last fall as I had not been to a primary care physician in many years. I asked her to see if we could check my blood work as I had put on more than a normal amount of weight over the last year and wanted to see if perhaps at my age, I was periMenopausal, or if there was anything else that could be contributing to the weight gain that I should be aware of. I was so disappointed when she immediately shifted into agreeing that my BMI is too high and that I need to start counting macros. I asked her to stop there and told her I had a history with disordered eating, and counting macros was off the table for me. I tried to clarify that I wasn't asking for help losing weight, and I was asking for help understanding what was going on with my body. Her next response was to work out at least 30 minutes a day and increase my protein intake, and if that didn't work, to come back in 3 months and she'd prescribe me a weight loss drug. I was so completely disheartened at her response to my inquiry. Needless to say, I have not gone back. If I wasn't already committed to a path toward intuitive eating, her advice would have led me right back into my disordered eating pattern and into what would have been just another failed diet. So I think this is really important to notice here, how this medical provider did not address the patient's real needs and was looking at her weight and just looking at the weight and nothing else. And unfortunately, this happens very often, and I have a lot of patients that have experienced this, and that leads them to not seek out medical care when they need it. And this is something that is also contributing to part of that misdiagnosis in our patients. And those in larger bodies are actually more likely to have the misdiagnosis or things like even cancer found at a later stage because they're afraid to go to the doctor, because when they go, they're automatically told that their weight is the problem. So I just think it's important to bring awareness to this. So we can therefore take a Christ-centered approach to health and see the bigger picture of health in our patients. It's important that we get to the root relationship with food. And struggles with food are often rooted in the following things like people-pleasing, fear of rejection, desire to be valued, wanted, and loved. They can be rooted in shaming and guilting, fear of disease, control, idolatry, trauma, inability to process emotions, learned behavior. So these different roots can cause our patients, or like even in myself, what I experienced, to use food in ways that was never meant to be intended. So when we tell patients, okay, you need to go lose weight, we're looking at the surface level problem. And I know as doctors and nurses or even dietitians, our role isn't always to get to the root. It's specifically, like, I am not the counselor, right, that works through maybe the deep trauma. But if I can approach my patient with an understanding that weight is not their problem, the food is not their problem, how can we offer support to our patients that looks at the whole picture? That is what is going to lead to effective care for our patients. So we can look at transitioning to a non-diet approach to healthcare. And this can make a change for a patient's overall health. So first, let's define health. The World Health Organization says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I think this is really important because, of course, we don't want people to be sick, but we also have to remember we live in fallen bodies in a fallen world, and there is going to be illness. I believe God can heal, and I believe he does heal. But we want to remember the health of a person is not just the absence of disease and infirmity. We want to look at the entire picture. And dieting does not promote health of a person. And it ultimately leads to more harm than good, as we saw earlier. So what is a non-diet approach? I put on here some examples of non-diet approaches to eating that have actual, dietitians and other health professionals that support, they give the steps to it, okay? They're models. But I will say a non-diet approach it truthfully is the way we were designed. God made our bodies to function. And yes, again, there are exceptions where there is disease, there are things that affect that function. But overall, big picture, God created our bodies to have things like hunger and fullness cues and to be able to listen to our bodies and not restrict and not diet for the purpose of weight loss. Like, that is not how God made our body. He instead made us to ultimately have freedom with food, okay? And some of these non-diet models of eating are like intuitive eating by Evelyn Tribal and Elise Resch. These are both dietitians. The Ellen Satter model of eating, she was also a dietitian. Mindful eating practices, and then health at every size is how, again, working with how can we approach health, not necessarily focusing on body size and looking at the bigger picture of the patient. So I want to break down the steps of intuitive eating. Again, there are different models, but I'm just going to talk about intuitive eating today. And there are 10 different principles. So the first, again, these are not done in order, but the first one is rejecting the diet mentality. This is basically when our patients choose to break up with diet mentality, decide I'm not going to follow the way of the world anymore. I'm going to look at my health from that holistic approach. And then they also can start learning how to honor their hunger. When we diet, it takes away our ability to listen to our internal cues. And the term for this is called interoceptive awareness. So interoceptive awareness is the ability to listen to things like hunger and fullness cues, or to be able to actually feel the heartbeat without feeling our pulse, being able to notice stomach growls and what does fullness feel like? What are the different cues my body is giving me? When we diet, it takes away our body's ability to accurately distinguish between hunger and our fullness cues. So with intuitive eating, we relearn, we reteach our body and our brain how to trust the body and brain and how to be able to feel hunger and fullness in the body appropriately. Then we also talk about making peace with food. This is taking away our moral stance on food. So I'm either good or bad for eating this or not eating that. And we learn how all foods, there can be a place for all foods. And we don't have to label something with a moral tie to it. Also challenging the food police. This is really the voices we hear, our mindset, our beliefs that we have around our bodies and food. And really, with patients here, I really challenge them to evaluate what their thoughts are. What are they thinking about? Is it based in biblical truth, or is that something that the world is telling us? Are we trying to meet a standard of the world, or are we really pressing in to what the Lord has to say? Discovering the satisfaction factor. God made food to be satisfying and good. And when we learn how to be satisfied in the food that we eat, we are less likely to overeat it and to really be able to listen to those hunger and fullness cues in the body. So this is a really important step that is often forgotten when we think about a healthy relationship with food. Because if we don't have satisfaction with what we're eating, we're constantly going to be looking for that thing that just hits the spot, right? Or satisfies that craving we have. So how can we eat a variety of foods and find that satisfaction? And the next step is coping with emotions with kindness. And this ties back more to some of those rooted things that might be going on, where maybe we don't know how to cope with emotions and food or without using food because that's all we've known. Maybe we've experienced trauma that we have never worked through. So if you're finding that that you have a patient that might be saying, I really struggle with emotional eating, this is where it might be helpful to say, hey, have you considered maybe some counseling to really work through that trauma? Instead of just saying, okay, well, go lose weight, that's not necessarily helping the patient heal the relationship with food. Respecting our body. This means respect the genetic blueprint of the body. Your body is uniquely made for you, and we're not all meant to fit a certain size. That's why the BMI scale, that might be a whole nother conversation, but the BMI scale is not really an accurate tool for us to be using in the medical field. And it wasn't even really properly implemented through the proper scientific method process. So our bodies are all made to look different, to be different, and we can be healthy, the healthiest version that we can of ourselves in our bodies the way that God made them. So respecting your body means like fueling it, feeding it 3 times a day with snacks, making sure I'm getting enough food for it, moving the body so it feels good, buying clothes that fit your body instead of trying to change your body into fit and clothes. All right. It's respecting your body with where your body is at. And that does mean nourishing it well as also, but it also means finding joy and pleasure with food as well. All right, finding movement and movement that brings joy. So not movement for punishment, not exercise for punishment. And then here's the big one that potentially could have been going through your mind. Well, what about nutrition, Brittany? Like, what about eating healthy? How do we do that? What if our patient has chronic disease? We can take a gentle nutrition approach with patients who do or do not have chronic diseases. And I've done this with my patients. And ultimately, when our relationship with food is healthy, we actually tend to make better choices in the sense of honoring our body than when we are dieting. Because when we're dieting, we often find that we're on a pendulum of, neglect the body and then obsess about the body, neglect the body, obsess about the body. Whereas this is more of an overall lifestyle aspect where it's not an obsession based. It's not all about the worldly perspective. So we can eat fruits and vegetables and grains and honor gentle nutrition while still allowing and making space for foods like brownies and chips. Okay. There's a way to do that is still healthy. So our patients benefit from taking this approach by noticing a decrease in stress, which improves and seeing improvement in stress management skills, decreases GI distress, increases positive body image and self-talk. It increases that interoception, which is that ability to listen to body cues. We notice that there's an improvement in lifestyle habits like less smoking, less drinking, increase in movement, and an increased consistent intake of fruits and vegetables. It also causes weight stability to be, rather than that yo-yo up and down with weight, which studies are showing that the more stable weight, regardless of the weight, is actually better than constantly having an up and down with our weight. We see an improvement in mental health, as well as healthier relationships and boundaries. And then for believers, which is so important, that's foundational, it's that stronger relationship with Christ and our stronger identity in Christ. And again, I have lots of studies that show all of these different claims. So just one study I'm just going to quickly summarize here. Study was done to show that, or they found, that healthy lifestyle habits are associated with a significant decrease in mortality, regardless of your BMI. So you could be considered obese BMI, or you could be considered regular or a normal with a normal range of BMI, and you still can see a decrease in mortality as we look at those healthy lifestyle habits. But I do want to remind us that it is important to remember that one of the limitations of this study they've noted, and it's important to remember this with weight in any study we're reading, is that although healthy habits were associated with decreased mortality, association does not prove causation. And we have to remember that also with how we try to blame a lot of things on weight with the causation of disease. So also pointing out a healthy lifestyle to optimize health. Many patients with a normal BMI may believe that exercise and healthy eating, for example, are less important for them as long as they maintain a low BMI. In fact, this patient view may be reinforced by healthcare providers who are also influenced by BMI and are therefore significantly more likely to counsel obese patients regardless of a healthy lifestyle than normal weight patients. And this is something I've seen and even have done myself as a dietitian in the past, which unfortunately means that we're not encouraging all BMI ranges to have healthy lifestyle patterns. So here's the big question. What would Jesus eat then? So I'm talking about this intuitive eating approach, this non-diet approach. I've shown the harm in how diet culture, disordered eating, and eating disorders affect us. But what would Jesus eat if he were here on earth still to this day? And what did he eat when he was on this earth? The truth is, Jesus did not eat to live a long life, right? He ate to fulfill his purpose. He met his physical needs. So what I mean by that is, yes, like it's not wrong to take care of our body, but Jesus wasn't like, okay, my goal in life is to live as long as I can. No, he took care of his body, honored his physical needs of his body, but he ate with the purpose of fulfilling the purpose that God had for him on this earth. So if we can shift our perspective of why we eat food to understanding why are we here on this earth, right? It's to fulfill the purpose God has for us. It can cause us to not obsess so much about the physical body. Again, there's an important role of the physical body. We are called to take care of it, but Jesus did not eat to focus on living a long life. Another important thing, when Jesus fasted, he didn't do it for a diet. He did that for spiritual purposes. Also, Jesus's ministry was really oftentimes around a table. He partook in Jewish festivals that celebrated with foods, and it was an important part of the ministry. He met with people. And when we are caught up in diet culture, again, we're not connecting with the people at our table. And it can be such a distraction, and the enemy can use that to prevent us from sharing the gospel ultimately. Also, it's important to note that nowhere in the Bible does God talk about a good and bad body weight. And God did say that God did say that man is made good in Genesis 1:26-31. And when Jesus was fasting in the wilderness and the enemy tempted him during his fast, and he responded with, man does not live on bread alone, he was quoting Deuteronomy 8:1-3. And it's just important to remember, food is important. God gave it to us to enjoy. But again, what is the purpose of our life? We don't live on bread alone. We live on God, who is our source of life, right? He is the everlasting. And it really is that perspective shift. Food is meant to be joyous, something to be grateful for. Ecclesiastes 9:7 talks about that, about having, joy in the food that we're eating. And we have permission to eat all foods. In Genesis 9:3, I know there are the Jewish things of the law that God said don't eat, but in the sense of, God gave us the plants and the animals, and he gave us permission to eat these things. And we do know that things in excess are not beneficial. It says that in the New Testament, right? All things are permissible, but not all things are beneficial. But that, again, it's more so about not being done in excess. If I just ate excess protein all the time, that's not beneficial. But if I have a balance of carbohydrates, fats, proteins, and all the micro and macronutrients, right? If it's balanced, including foods that might have more vitamins and minerals versus maybe some of our dessert foods, which is still food, still nutrition, we can have a balance of that and our bodies can still function well and be healthy. So here's some practical steps that I have for you as health professionals, or whatever your role is in the medical field. In this, it doesn't have to be medical, right? Like, we can still take this non-diet approach in our everyday life. Again, I live this out in my everyday life, but I also get to do this in my practice. But we can incorporate these things like collaborating with other non-diet centric dietitians and other health professionals. We can provide non-diet training to staff and other leaderships. We can pursue certifications and non-diet approaches like the Christian Non-Diet Advocacy Corps certification, or becoming an intuitive eating counselor. There's other ones out there, but like that, but that can help you expand your knowledge and understanding of it. You can incorporate screenings for eating disorders and disordered eating into your intake forms. And again, this is really important because it's not looking at weight. It's looking at what the underlying response would be for the patients? How do they answer those questions? Are they at risk for these two things? When patients have concerns about weight, try using non-diet conversation and focus on health-promoting behaviors that are not centered around weight loss. So a lot of that also shifting that, okay, we take this away. Instead, focus on what can we add in? What is the reason the patient is struggling with food? Is it because they don't have time to cook? So what can we add in? Can we look at something like, when I say add in, maybe it means taking things out of their schedule and adding in time for resting and family time. If they can't do that, how can we incorporate stress management into their day-to-day life so that they're not eating out of a place of stress with proper emotional coping, right? So when we're not focusing on the weight loss, it overall helps the patient. Whereas if we tell the patient when they come in, oh, you just need to lose weight, we could be contributing to all the other factors in their life that are really causing the struggle with food. We can also prescribe proper diagnostic testing when we are concerned about health regardless of weight. Okay, so again, doing our due diligence to not have weight bias and being sure that all patients are getting proper care. Also, not looking at the patient and blaming their health condition on their weight. That can be really defeating for a patient, and it can contribute towards more problems. And oftentimes, honestly, most of the time, we can't even guarantee that the condition is because of a person's weight. Take the approach of humility and make the assumption that there's always something that you can learn from your patients. And this goes from Proverbs 18:13, listening before we're speaking. Hear them out. Listen to what the problem is. And don't just make the assumption it's because of a patient's weight. I had a client this last week who experienced knee pain and immediately started blaming her weight on it. And we were talking about this, and she said, for the first time in a while, I've been tempted to get back on the scale and maybe start trying to lose weight again. And we talked through that, and I said, okay, so what did you do to take care of your knees when they were hurting? She said, well, I rested them. I stopped because she exercises, up to 5 days a week usually is what she normally does. And she has a balanced diet, and we were talking about this. So I said, what did you do? She said, oh, I rested it. I took care of it. And I said, okay, so do your knees still hurt? She said, no. So it's like, okay, so do you really believe that your weight is the cause of your knee pain? Or do you think that it's possible that maybe in your workout class, you just kind of tweaked it the wrong way and hurt it, and when you rested it and took care of it the right way, it got better, and it's not because of your weight that caused your knee pain? And when we talked through that, she realized, wow, I've been so conditioned to think that all my pain in my joints is because of weight. And here's the truth, it's not. And for this particular patient, she's fine now. And so again, I've had so many of my patients walk into clinics and be told that any pain they have is because their weight, when in reality it's just they need to rest it. But instead they put their body through something even harsher, like dieting and more exercise, trying to lose the weight, which makes the pain worse, rather than just resting it and honestly just respecting their body. So these are all ways that as health professionals, we can incorporate this into our patients' lives. And I want to end out here with a couple of verses. Jesus declared, I am the bread of life. Whoever comes to me will never go hungry. Whoever believes in me will never be thirsty. John 6:35. And Matthew 6:25. Therefore I tell you, do not worry about your life, what you will eat or drink, or about your body, what you will wear. Is not life more than food, and the body more than clothes? Thank you so much. And I know there might be quite a bit of questions from this. Again, this is a big topic. I do want to say again, this is not to make a black and white statement. I understand there are sometimes exceptions in certain situations, and we aren't able to cover every single point of this presentation in detail. But I would love to be able to talk more, answer any questions you might have. So please feel free to reach out to me if you have any on our conference app or through my email, Brittany, BRITTANY, @myrevnutrition.com, and I would be happy to answer any. So thank you. Have a blessed day.